Welcome to the Wyoming Vein Specialist and Casper Medical Imaging YouTube channel. I'm Dr. Charles Backley, and thanks for tuning back in. So we've talked a lot about the different treatment modalities for lower extremity venous insufficiency, truncal venous insufficiency, and lower extremity varicose veins. Now, you can go back and review a couple of the terms from the prior discussions that we've had, but really understand that one of the mainstays of treating the lower extremity veins is adequate compression after you've had treatment. I'll say that again, adequate compression after you've had treatment. Why is that so important? If you think about my hands as the inside of the vein or the endothelium, that is the active area of the vein that we're trying to treat with any of those modalities, whether it's detergent-based, glue-based, heat-based, mechanical-chemical-based, it doesn't matter. The idea is that that endothelium is what's going to be irritated and inflamed, and then when compressed, it will heal shut. I liken this to placing a dam at the top of a waterfall. A waterfall flows with gravity, just like your superficial truncal veins flow with gravity, filling up pools down below. When the walls of the endothelium come together and they heal shut, it's like putting a dam at the top of the waterfall, preventing that flow. And that's actually what creates the redirection of blood flow to the deep system. So it depends on who your practitioner is, where he or she trained, and what their own internal practice paradigm is like as to how long you will undergo compression. There are a whole bunch of different literature pieces out there that describe the length of compression, meaning from the foot cephalad or up towards the pelvis, the intensity of compression, how strongly that compression sock should press on the limb, and the gradation, meaning how many millimeters of mercury. These are typically referred to as different classes of compression. And then finally, the duration of compression, how long you need to be in compression to get an adequate or desirable end result. Now, we could spend months, years debating what is the right paradigm. However, our practice here at Wyoming Vein Specialists has determined a 2-week compressive duration after any of our treatments is appropriate. And the reason why is our proven experience, 99.9% closure rate. That's really hard to beat. Now, there are some trials out there that show a shorter duration of compression with good results, but not 99% closure rates. So how do we do it here? As soon as we're done with whatever therapy it is that we've performed, we immediately place the compression hose on in the treatment room. Those hoses stay on for 3 days around the clock. Yes, 24 hours a day. No showering, no bathing. You can sponge bath and toilet, but no taking the hose off completely. They go with you to bed and you sleep in them, and then you wake up 3 days around the clock. The remainder of that 2-week period of time, so 11 more days, you wear them only when you're up and walking around. So what I tell my patients is, on that day, you're going to wake up, you're going to take the socks off, you're going to shower, toilet, do whatever your normal morning routine is, you're going to dry off because they're hard to put on if you're wet, and then you're going to put the hose on. You're going to wear them all day long until you get into bed. You're going to sit on the bed at the end of the day, you're going to take them off, you're going to put your legs in bed, you're going to lay down and you're going to go to sleep, and then you're going to copy, paste, repeat the next morning. So remember, 3 days around the clock, and then for the remainder of the 2-week period of time, you're going to wear them just when you're up and walking around. That's how we do it here with proven results. Thanks for tuning in, and remember, we'll walk with you until your legs are healthy again.